1, code 2.
2.
Code 2. Standard precautions, glove and goggles.
Yes.
Are there any dangers?
No.
No. Hi, how are you going? My name's Hayley. This is my partner Bob. What's your name?
I'm Georgia.
Georgia, no worries. And how old are you, Georgia?
I'm 18.
No worries. What was the problem today?
I was playing netball and I went up to shoot a goal and I felt something tear in my side.
You felt something tear?
Yeah.
Are you comfortable where you are right now?
Yeah.
Are you sure?
Yeah, as comfortable as I can be.
Have you had any relief at all? Any kind of positions help you, or?
No, just sitting down like this.
Sitting down like that? No worries. So how long has the pain been going? Just when you went up to shoot the goal?
Yeah.
Or did you have any pain before that at all?
No pain.
You've never had it at all when you've been playing before?
No.
No, nothing similar?
No.
Have you ever had any other injuries when playing netball or playing other sports?
I sprained my ankle once. But
Ankle, okay.
nothing really.
No worries. And so is it just radiating down? Is it just down your abdomen, or has it radiated anywhere else? Can you feel any other pain at all?
It's kind of just going up into my armpit a little bit as well.
Into your
Just
armpit?
into the top of my arm
And how long ago was it that you felt the tear?
there. Probably about 45 minutes.
45 minutes, and it's been at the same pain rate for the
Yeah.
last 45 minutes?
Yeah.
And what would you rate that? From 1 to
Probably a
10?
9.
A 9? No worries, so pretty severe pain?
Yeah.
No worries. So have you taken anything at all? Have you had an ice pack or?
No. I
Panadol?
No, nothing. It's just that, yeah.
So are you allergic to anything at all, Georgia?
I'm allergic to Panadol.
Allergic to Panadol? Do you know what it is in the Panadol that makes you allergic?
No, I just get a headache.
You just get a headache when you have the Panadol? And is this just something that you've experienced over time, or has the doctor confirmed that? Or
Just from my own experience.
just from your own experience. Nice. So have you had any past history of injuries other than your ankle?
No.
No,
Just
no
this,
injuries.
Yeah.
No worries. Have you had any hospitalisations in your family? Have you yourself been to hospital for any abdo pain outside of sport?
No.
No, no worries. Do you smoke or drink at all?
I drink.
Occasionally? Do you binge drink a day?
Um,
How often do you say you drink?
Once a week.
Once a week? And how much do you usually drink once a week?
10 drinks or so.
10 drinks? Was that over the course of the week, the weekend, or
No,
just on
just
one
one
day?
night.
Just one night? So it's okay. I'm just going to grab a chair and come sit next to you rather than
Yeah,
sitting on the
sure.
floor. Horrible chairs. No worries. So I'm just going to take your heart rate if that's okay. So I'll just get you to rest either arm, whichever one's more comfortable for you. So she's got a heart rate of 80 beats per minute, which is within the normal range. So there doesn't seem to be anything else there. So I'm just going to take your heart rate as opposed to your chest, if that's okay. So I'm just going to get you to place it like that. So she's got a rest rate of, sorry, you can put your arm back down where it's comfortable for you now. So she's got a rest rate of 12 beats per minute, 12 reps per minute. So that's with the normal limits as well. So her skin is warm, pink and dry, and she's conscious, so she's adequately perfused.
Yes.
I've just got to do your blood pressure if that's okay. Have you had your blood pressure taken before?
No.
No. So it's just going to be a tight squeeze if that's okay.
Yeah.
If it hurts too much, just let me know.
Yeah.
For you. So I'm just going to get you to keep your arm how it was before, just resting with your hands up if that's okay. I'm just going to pop this underneath your arm. Just lift up for a second.
I can't really. Sorry.
You can't lift up. Would you like me to do it on the other arm?
Yeah.
Oh, not here. Okay, so just get that there. Just a tight squeeze. So systolic measured at 123. So I'm just going to auscultate it at the moment. So I'm just going to listen to your arm and do the blood pressure again. So it's just going to be tight again. Was it comfortable?
Yeah, it's fine.
Yeah, no worries. Pardon?
Oh,
No, that's okay. Thank you. Just going to be a little cold. Sorry. So it's just going to be a tight squeeze again.
okay.
Oh my god, sorry. And the diastolic measured at 84. So it's 123 over 84 for the blood pressure. So I can say that she's adequately perfused. So her heart rate's within a normal limit, her skin is warm, pink and dry, she's conscious, and her blood pressure's within a normal limit as well. So I'm just going to check how you're breathing if that's okay. So she's in a position where she's comfortable. Her appearance, so she doesn't look really flushed, she doesn't look pale. She looks warm, pink and dry. So I'm just going to listen to your chest if that's okay.
Yeah.
If it's not too hard for you, give me a bit of a cough. Yeah. Yeah, was that okay?
Yeah.
Yeah, and if it's okay, can you lean forward a little bit so I can just listen to the back of your chest? Just as far as you can go, don't go too far if it's uncomfortable. And I'll just get you to not talk if that's okay. So just 2 deep breaths, just keep deep breathing. Breathe in through your nose and out through your mouth. And I'm just going to listen to the back of your chest. Is it okay if I move your hair here?
Yeah, that's fine.
So her left didn't quite equal right. there was airflow from axes to bases, and there was a little adventitious sound in that she had a little bit of crackling in her left lung. Just minimal, not anything to worry about. This is a little, yeah, just a tiny bit. So her rate and rhythm weren't too bad. She was pretty equal with her rhythm and rate. So it was 12 respirators per minute, which is average. So it's not too bad. She doesn't seem to have any effort, any trouble breathing. She's not using any accessory muscles. Yeah, so her sounds were, there was adventitious sounds in the left lung, and her pulse is within the normal limit. So her respiratory status assessment isn't anything too out of abnormal. So she's not doing too badly. So for her GCS, I'm just going to ask you a few questions if that's okay. Do you know what day it is today?
Friday.
Friday, no worries. Do you know where you are?
Yeah, uni.
Yeah, what year are you doing?
What year of uni am I doing? First year.
First year, no worries. Do you know what you're studying?
Yeah, sports recreation.
Sports recreation, no worries. And can you just do me a favour and reach up and squeeze my fingers for me, please? Yep, just as hard as you can. Yeah, no worries. And can you just do me a favour and if your hands, have your hands out, touch each finger, your pointer finger with your nose with each hand. Yep, no worries. So for her eyes, I give her 4 because she's looking at me, she's spontaneous. For her verbal, she gets a 5 because she's conscious. She's listening to my, not listening, sorry, she's answering my questions appropriately. For motor, I give her a 6 because she can move her limbs, but there was a little bit of weakness in her left-hand side grip. So I give her a 15 for her GCS, and her pupils seem to be the same size and they're responsive. I'm just going to get my partner to do your blood glucose, your temperature and your oxygen saturation. Have you had your glucose taken before?
No.
No worries. So it's just going to be a small prick. They're just going to take a little bit of blood and then measure the sugar in your blood if that's okay. Yeah, no worries. So I'm just going to do a bit of an assessment on how you're feeling, whether or not there's any bruising. Do you know if you have any bruising, swelling or rushing at all?
No, I haven't taken my top off.
No worries. Is it okay if you extend your arm or is that too uncomfortable for you? Yeah, that's okay. Just put out your fingers for me. No tension, no tenderness.
Yeah.
Does that hurt? Whereabouts does that hurt?
Oh, it's just because you're kind of moving.
No worries. Is that hurting there? Still hurting?
Yeah.
What about that?
Yeah.
Can you move your shoulder for me?
Yeah, it just hurts a bit.
Just hurts a bit?
Yeah.
No worries. So I'm just going to have a look if that's okay.
Yeah.
Is it okay if we don't actually take a quick? Yeah, no worries. So there's just a little bit of bruising, just a little bit up on the bottom of the rib. Other than that, it doesn't seem too bad. Have you got any pain anywhere else at all?
No, it's just really up and down.
Just up there? No worries. Any pain in your legs? No bruising, no rushing. You didn't fall at all?
No.
No, you just... Alright, so with our head to toe, there's a bit of bruising and there's tenderness from underneath the armpit all the way down to, was it the bottom of your ribs that sore, or is it all the way down to your hip?
All the way. Yeah.
All the way down to the hip? Yeah, no worries. There's pain all the way down to the hip. So I'm just going to check if you've got a pulse on your arm just to see if everything's done properly. Just move it there if that's okay. Yep, so she's got a distal pulse. There's blood flow adequate to the arm.
Nice.
I'm just going to put the ECG on you if that's okay, just see that everything's working with your heart. I'm just going to put 3 leads on you. So white on right, the black one which isn't here on the left side shoulder, and then the red one down the base. So I can't diagnose you at the moment. I don't know exactly what's going on. So is it okay if you be transported to the hospital?
Yeah.
So maybe they can help. Yep. Do you have any concerns before we go to the hospital?
No.
Her main concern is her pain.
No worries. So would you like some pain relief at all?
Yeah.
Yeah? Have you ever had penthrane before, the green whistle?
No.
No? Have you ever had any other injuries that you've required pain relief before?
No.
No. Do you have any kidney